Hello, everyone, and welcome to PerfectServe's quarterly customer webinar. My name is Carlene Anto. I'm the Vice President of Marketing here at PerfectServe, and I want to thank all of you for joining us today. I'm going to start out with just a couple of housekeeping items. You may have noticed that we are using a new webinar platform, GoToWebinar. We're very excited about that. So just a couple of navigational hints. On the sort of vertical icon display, you will see a little chat bubble at the bottom, and that is how you will submit questions for our speakers today throughout the presentation. Everyone is in listen-only mode. You can also access today's slides by using the handout pane. You should see a gray bar with the word handout. If you expand that, you will see a couple of handouts for today's presentation. If you just click on those, they should download to your computer. And lastly, this webinar is being recorded so that we can share that with you and those that could not attend. You will receive an email after this webinar with a link to access the recording. Now let me introduce to you today's speakers. We're excited to have Terry Edwards on today, our President and CEO. He will be talking a bit about product strategy and vision. We have Jeff Brown, the ever famous Jeff Brown, the MC that we love to have on these calls. He is our strategic Senior Vice President of Strategic Accounts and Initiatives. We have Mary Hatcher, our Vice President of Product Development, to talk about some details around the roadmap. And we're also very excited to have David Nichols, who is the former COO of CareWire, former founder and COO, and is leading the product strategy for our patient engagement solution today. So at this time, I'm going to turn it over to our MC, Jeff. Jeff, please take it away.
Thanks, Carlene. Good afternoon, everyone. This is Jeff. Thanks for joining us today. If this is your first webinar, welcome. And if you've participated previously, thank you for joining again. We really do appreciate your continued support. As I've mentioned in the past, the goal of our webinar series is to keep you updated on product enhancements, new capabilities, new modules, et cetera, and maybe most importantly, hear from you and share how our customers, how you are applying PerfectServe in our environments or in your environments. We want your questions and feedback. We really want to consider the voice of the customer in everything we do. So with this in mind, please don't be shy today with questions and feedback during our time together. In terms of agenda, we've got a great lineup. As Carlene shared with you, we're super excited to have Terry Edwards, our founder, president, and CEO, kick things off for us today. Terry will provide us with a quick review of 2018 and then walk us through PerfectServe's product vision and really what's guiding our product strategy. As in past meetings, Mary will then give us a product update and share with you all the exciting things her team is working on. And then David, another new face, will give you an update on our exciting new patient and family communication capabilities that we now have available for our customers. And like with previous webinars, we'll take questions after each discussion topic. And recall, as Carlene mentioned, you can ask questions via the chat box on your screen. And as always, we will wrap up things again at the end with a Q&A session, time permitting. So with that, let's get started, and let me turn things over to Terry.
Thank you, Jeff. Well, welcome, everyone. I want to thank you all for joining today, and I want to thank you for just our long-term continuing relationship with you. We are just delighted to have you all join. We really believe that we're here to help our clinicians provide better and more efficient care, and we wouldn't exist without your commitment to improve clinical communications. We now are supporting nearly 500,000 clinicians across more than 250 hospitals and some 25,000 practices and post-acute care organizations. And we've really seen a real surge in the growth of the organization, with 2018 actually being a record in terms of our signing new practices, as well as integrated delivery networks and hospitals. And we believe that's really a testament to the work that we've been doing and the contributions we're making to help clinicians provide better care. So what I wanted to do today was just take about 5 minutes and give you a real high-level vision in terms of where we're headed. Our long-term strategy is evolving. And Sarah, you can go ahead and click to the next slide. And I'll start just by mentioning that the market for clinical communication and collaboration is really starting to hit the mainstream. We think that we saw that last year with a number of new systems licensing this type of technology, and new technologies will go through what Gartner calls their hype cycles, where there'll be a trigger event and to trigger a new innovation, and it'll hit a peak of inflated expectations and then drop down to a trough of delusion. And the technologies that make it through that will start to see Main Street adoption by most health systems, and that's what we're really seeing. We saw that kick off last year, and I think Gartner's confirming it, and we expect to see that continue to grow, the market to grow over the next few years. Next slide, Sarah. So that's been the communications part of the industry, but where the industry is really evolving to is one of enabling care team collaboration. And I want to speak to that too in the context of the real-time healthcare system. And the concept of the real-time healthcare system is a concept Gartner had created back in 2010 when we were right in the heyday of digitizing electronic medical records. And along with that, we've been digitizing other information. And so as we now are past that peak, sort of the next major transition from a technology standpoint is to leverage this information in ways that can enable clinicians as well as business people on the business side of hospitals and health systems, as well as practices, make decisions in real time that can improve efficiency, can improve outcomes, and allow organizations to perform at a much higher level. And so this care team collaboration ecosystem really includes a number of different technologies that are sort of outlined in the puzzle pieces here. And this isn't everything, and this is an evolving sector, but within it you'll see 5 dark blue puzzle pieces. So nurse call in the upper left-hand quadrant, CC&C, or clinical communication and collaboration, in the right quadrant. That's been PerfectServe's core business. A contact center in the middle that touches many of these things, and that could be anything from like a patient access center or transfer center to even a hospital switchboard. Alarms and notifications, primarily in the acute care environment, but that will evolve to encompass the entire patient ecosystem over time. That's the ANN. And then down in the lower right-hand quadrant, interactive patient care. Sarah, go ahead and click again. I think we've got some circles in there. The thing that we're working towards within the organization is trying to be able to leverage these technologies either through the deployment of them through the PerfectServe platform or in our portfolio, as well as through integrations. And so what I've got depicted here in the dark circles, and I'm going to share some news with you in the next slide, is the hardline circles are the capabilities that we're able to bring to the table today, and those that are in the dotted lines are the ones that we're considering that are not too far afield from where we're at right now. We haven't prioritized those, but there's opportunity there that we see to bring more value. So next slide, Sarah. So what's guiding us right now is really about building the care team collaboration platform of the future and evolving PerfectServe from purely communications to be this broader platform to deliver the most value within this care team collaboration ecosystem. And so to that end, there has been some news that has come out, but you may know that we announced a couple of weeks ago that PerfectServe had acquired Telmetic. Telmetic is a consolidation within our current space of clinical communication. This is a company that we've known for some time and have been watching them. They've been an up-and-comer and very close to PerfectServe in technology, but there's some other things that they have done that we have not done. So they're a little deeper into the nursing space, but they're also bringing contact center capabilities as well, along with improvements in mass notification. So with that foundation of both PerfectServe and Telmetic, we have layered on CareWire, and you heard Carleen introduce David Nichols. David is the founder and was the chief operating officer of CareWire, a Minnesota-based company. And with CareWire, we were able to acquire patient and family communications capabilities. And I'm really excited about this company. We'll be integrating it into the platform. But what's unique about CareWire is it starts with the lowest common denominator, and that's SMS texting, and then moves up into a secure messaging environment. And there's just a host of use cases there that we think can add value. And then we'll be announcing next week. We haven't formally announced CareWire or Lightning Bolt. Those announcements will come out next week, but or 2 weeks from now. But Lightning Bolt is the third acquisition. And Lightning Bolt is a leader within the physician scheduling space. And Lightning Bolt does physician scheduling from a broad workforce component. Everybody on this call should know that PerfectServe has very robust scheduling built into the platform. And yet that scheduling capability has been limited to the call schedules or other schedules that are part of a communication-driven workflow. And so with Lightning Bolt, we will be able to bring comprehensive scheduling capabilities to our customers over time. There's a lightweight level of integration that we expect to get done this year, and then longer term, we expect to replace our scheduling services with Lightning Bolt capabilities. And we'll have another webinar about Lightning Bolt at a later point in time. So you see some question marks up there as you look at different colored dots, but that's where we're headed. We do expect to announce more organic development capabilities into the platform, as well as other acquisitions over the next 2 and 3 years. But common to all this really is PerfectServe's strength to automate and streamline workflows and really leverage that within our platform. So I wanted you to just have a picture of where we're going, where we're headed, what we're trying to be, and the value that I hope we'll be able to continue to bring to you and your peers and colleagues in the future. So with that said, I'm going to turn it over to Mary and let Mary continue on to talk about our roadmap and other enhancements.
All right, outstanding. Thanks, Terry. Lots of great information and insight there, and it definitely helps set the stage for what I'll share with you today with our product roadmap. But first, I do want to tell everybody thank you for joining us. Your continued participation in these webinars has really been outstanding, so thank you. So when we met back in October, I started off with a high-level overview of our 2-year roadmap, and I want to show this to you again just to help bring some context to what we're working on. It also shows how our roadmap aligns with the vision that Terry's laid out. So again, here you can see that 2018 was really focused on maturing our nurse solution, and there was tremendous progress made during the second half of 2018 on that. So several of these items that you see in the hospital integration section come together to ultimately form our care team alarms and notification solution, which I'm going to present in greater detail here in a moment. As we move into 2019, you'll see a great focus on patient engagement with patient and family communications at the heart of it. And as others have already stated, David Nichols has joined us today and is going to be sharing with you the exciting capabilities that we currently have available and how we'll evolve that in 2019 and beyond. In addition, we plan to deliver some new capabilities to support your needs with mass communications and contact and transfer centers, as Terry mentioned. And with our acquisition of Telmetic, we plan to accelerate delivery of these solutions and expand those capabilities that we've already deployed. In addition, we're making some great improvements with our self-service capabilities, including giving end users the ability to create and configure solutions for doctors. So I'm going to give you a sneak peek of that today. And then looking at 2020, you'll see an increased focus on population health, virtual care, and referral management. So lots of exciting capabilities as we expand our offering to cover the technologies needed for a full care team collaboration solution. So let's go ahead and move on, and we'll take a deeper look at a couple new capabilities. I'm going to focus on 3 key areas, which will include care team alarms and notifications, our new single sign-on capabilities through upstream identity providers, and then finally, as I mentioned, a sneak peek at our user configuration capabilities. As you would expect, an essential solution that goes hand in hand with deploying smartphone devices to nurses and other care team members is to enable the delivery of nurse call alerts and other medical device alarms to an app on those smartphone devices. So we've wrapped up the work to deliver these capabilities and are excited to have clients begin using it. PerfectServe historically has had years of experience delivering urgent alerts to clinicians, which has really positioned us well to come out of the gate with a very strong product offering as we begin delivering nurse call alerts and medical device alarms to nurses. Plus, we've got several great integration partners that we've worked with in this process. You can see here that we've done a direct integration with Rolland, which allows us to seamlessly deliver nurse call alerts and bed alarms to care team devices and enables the automatic callback into the patient's room. We're also able to deliver nurse call alerts from Hillrom and Westcall nurse call systems. In addition, if you've got medical device alarms that you need delivered to nurses, we're now able to integrate with Connexall and Bernoulli as the middleware solution to deliver those. So we've accommodated for ultimate flexibility with these solutions with regards to how you handle nurse and staff assignments. So not only is PerfectServe able to pull those staff assignments from multiple source systems, such as Nurse Call, EMR, middleware, etc., but can also serve as the source of truth by allowing your staff to manage those assignments directly within PerfectServe. And this is all to ensure that we deliver alerts to the right caregiver. So if we'll move to the next slide here, one of the final features we're releasing to support the overall nurse mobility alarms and notification solution is to allow customized alert tones based on the priority or severity of the alert. So we're making 30 distinct tones available, and these are selected and established by leadership, which keeps them consistent across the entire nursing staff. This becomes really important with the more critical alarms that we deliver. You want to make sure that your staff can quickly recognize the priority of one tone from another so that they're able to manage the communications most effectively. Completing this work further enables us to offer you a comprehensive clinical communication solution that can allow you to reduce the number of vendors that you're managing, and it gives you a single, fully integrated solution for nurses and physicians all on the same platform. You can go to the next slide. So let's talk about here our latest capabilities around authentication. And I know this isn't the most exciting topic, but it certainly becomes important as your IT and security teams are managing users of all the systems you have in play. So for quite some time, we've had the ability to authenticate against our client's Active Directory through LDAP over a secure VPN tunnel. And this has worked well for us and for our customers, but I'm really excited to tell you about our latest development efforts, which will offer additional capabilities and a much easier deployment process. So we're now able to offer you a single sign-on solution using OAuth 2 framework with OpenID Connect, and authenticate with upstream identity providers such as Azure AD and Okta. Through this approach, we're able to support multi-factor authentication by handing it back over to your identity provider, where you're able to fully control that process. So with this solution, it no longer requires a VPN connection. The setup is very simple, and it's consistent with other applications that you would set up through these identity providers. So development for this is wrapping up now. We've just completed some initial testing with our development partner, and we'll be deploying it to end users in the next several weeks. And then we expect to have this capability to be GA by the end of the first quarter. So this opens the door for us to have a much simpler approach to user provisioning in the future, which should eliminate a lot of the burden that we share today in manually creating users in the PerfectServe platform. So you definitely should expect to hear more about that in the coming months. We can move on to the next one. So the final thing I'll show you is some of our new configuration capabilities. In our last webinar, we looked at our new client service portal, which is a customer application that we also use internally, and it allows you to create and administer users of PerfectServe. So in it, you have access to create, remove, unlock, and change settings for nurses, physicians, and other staff. And we released this at the end of 2018, and we have a large number of clients that are already using that. So with this application, we're continuing to build new capabilities, and our next release enables a full copy of a physician's configuration over to another user, which really streamlines the process of adding a new user to an existing account or building multiple users within the same account. So offering this very simple approach to configuring dynamic intelligent routing allows us to put this control in the hands of our hospital and practice administrators, which is something that clients have been asking for quite a while. So on this screen here, I would have just created a user, let's say John Smith, and then I land on this screen, and it's asking me which user's configuration I want to reference or copy. This would be a small list of referenceable users, and it's based on the permissions of the person who's logged into this application. So as you hover over the users here, you can see some details about their hospital affiliations, their work groups, their schedules, etc. And then once you choose who you want the new user to replicate, you'll see this next screen where John Smith has automatically been configured. So it's an extremely simple workflow here that allows for rapid configuration of a very complex solution. And if you go to the next slide, Sarah, we've made the same capability available in bulk. So I might have one doctor that's fully configured in an account, and I can come to this screen and select a full list of others, so maybe 5, 10, or 15 doctors in that same group to whom I can automatically assign that exact same configuration. So this particular solution will come in extremely handy for configuring residents during the big resident turnover that happens every year, amongst many other things, just building users into large accounts, adding users to existing accounts, etc. So this is being released internally at PerfectServe this week so that our staff can test it out and begin using it for configurations. And then we're targeting to release this to customers during the month of March. So that wraps up the product updates. And I'm going to go ahead and pause here and turn it over to Jeff to see if we have any questions.
Great. Thanks, Mary, and thanks, Terry. Let's see your question. So question here for you, Mary, related to alerts and alarms. What devices are supported?
So with alerts and alarms, PerfectServe can deliver them to really almost any Android or iOS device. This includes the leading enterprise devices like the Zebra TC51 or the SpectraLink Versity, and it also includes the modern consumer phones like iPhones or Android devices from Google, Samsung, etc. PerfectServe users can also access alerts and alarms through our secure web application, which can be a great solution for unit secretaries and other roles that are a little bit more stationary. So if these users aren't carrying smartphones, we can notify them of alerts through a telephone call, pager, text message, or through traditional wireless handsets like the Cisco 79 series phones. So we've really built this to cover a wide variety of devices and workflows with this solution.
Great, thanks, Mary. And just as a reminder, if you have questions, you can use, as Carlene showed, on one of the first slides, you can use the chat box to submit them. Let's see, question about something Terry said, but I think it's, Mary, probably directed towards you, around Lightning Bolt. Do you have the timing for when the integration might be available with kind of Lightning Bolt and PerfectServe talking to each other?
Yeah. So on that, we're planning to do the Lightning Bolt integration in a couple phases. So I would say right now we're looking at the second quarter, probably at the beginning of the second quarter, we'll be doing the same schedule sync integration with Lightning Bolt that we have in place with QGenda and Amion. So this allows users to continue to use Lightning Bolt or start using Lightning Bolt for schedule creation and management, and then have those schedules automatically sync over to PerfectServe so that they can be used for clinical communications. And then we're expecting in a later phase, which we still have a lot of discovery to do around this and the timing of it, but we'll take the power of the Lightning Bolt scheduling solution and all of its intelligence around automatically building schedules and handling more of the workforce management, and actually use that as the foundation of the PerfectServe scheduling solution. So with that, it's going to offer a more streamlined experience for our end users and offers more power and features within the scheduling component of PerfectServe. So timing of that is still to be determined.
Okay. Another related question here. Does the Lightning Bolt acquisition have any impact on existing integrations with either QGenda or Amion?
Yep, that's a good question. I've had several others ask that as well. So no, we'll continue to fully support the integrations with QGenda and Amion. So and not only for existing clients, but any new client that wants to leverage those integrations, we would fully support that. Our goal with Lightning Bolt is really to be able to bring customers a fully integrated scheduling solution to eliminate the need for them to have to bring multiple vendors together. So we just want to make that capability available as part of the PerfectServe platform. But it doesn't prevent us from continuing to support and grow the integrations that we have with QGenda and Amion.
Okay, great. Well, just due to time here, thanks, Mary. We're going to move on to David, and then we'll circle back with if there's additional questions for either you or Terry. So, as Carlene mentioned, I think Terry mentioned as well, David, founder and COO of CareWire, who's now a senior strategic product manager on our product management team. Super excited to have him with us today. Super excited to have him on the PerfectServe team. He's going to walk us through our new patient engagement capabilities. So with that, David, the floor is yours.
Thanks, Jeff. We're going to talk for a couple of minutes about patient and family communication. And before we do, let's really talk about what this really means. There is a lot that happens before a patient arrives at the four walls of your facility, and there's a lot of important things that happen after a patient leaves. And the idea of patient and family communication is to automatically interact with those patients, give them education, ask them questions about their condition, provide them with information that's helpful for them to recover, and then report back issues to staff. All of this happens automatically. The key goals are to save staff time, increase patient and family satisfaction, but ultimately to increase quality and business metrics. In addition to this automated activity that we'll be talking about over the next couple of slides, another key part of this is the ability to allow staff to securely chat with patients in the spirit of patient flow and other initiatives. The secure chat capability allows staff to literally reach out and touch a patient in a minute when it would otherwise take minutes or hours to reach them by phone. So the next couple of bullets on this slide contain a lot of buzzwords, but the big idea here is that this technology uses the ubiquity and the power of SMS texting, which is something that Terry had mentioned before, and combines them with app-like experiences, which are similar to what they might experience now through portals and apps in your organization. It's really the best of both worlds. And this manifests itself in the bottom of the slide here through kind of three key areas. One is care navigation, supporting patients and their families before, during, and after procedures or visits. Readmission risk reduction, avoiding readmissions that impact costs and financial reimbursement. And finally, chronic condition and wellness management. You know, in an era of patient-centered medical home and ACO initiatives, this is helping patients manage their chronic health conditions between appointments without increasing the amount of staff dedicated towards those initiatives. Sarah, if you could flip. So again, you know, Terry mentioned that you know, the power of all of this starts with the humble text message, which all of us should be familiar with. You know, the first three items here really speak to the simplicity, but also the power. It's a comprehensive, secure mobile solution. It's easy to use. There are no apps to download or configure. And much of this activity is automated. It's scheduled, condition-specific pathways. But some key differentiators that are really exciting, and we'll talk about in more detail, are insight-driven personalization. So a buzzword in the industry right now is social determinants of health, which really means whole patient insight, really understanding what a patient is going through during all the times in their life when they're not actually at your site meeting with your clinicians. Very powerful and very important part of healthcare delivery. On-demand interactive member and patient conversations. Again, the ability to skip the phone and literally instant message patients to get work done, and more than that, do that in a secure way. And then finally, all of this within the context of workflow. So presenting this to patients and presenting this to staff in a way that supports how they actually do their work on a day-to-day basis, but also providing the ability to integrate back into the source records and EMR systems as necessary. Sarah, let's go to the next slide. So we're going to go through a couple of these three key topics that we talked about on a prior slide. One of the first is care navigation, and the text on these images is going to be kind of small, but the idea here is sending a sequence of text messages to patients starting as early as 10 days prior to a complex visit or a procedure to advise them on exactly what to do. The messages on these slides have to do with confirming their attendance, having them access self-service portals that you may already have to provide their medical history, providing them with patient financial responsibility where that's appropriate, giving them precise arrival times that contemplate the differences between local, general, and regional anesthesias, providing specific location, and especially specific location having to do with complexities around construction, parking garages, and so on. And then finally, detailed NPO instructions where that's appropriate. So adding all of this up and having this happen automatically leads to a 10x increase in self-service education and tool usage, up to a 50% increase in improvement in no-show rates. And then the ability to automatically rebook 75% of no-shows without having a nurse or a staff member intervene. And then all of this positioned in a way that increases the overall patient satisfaction and reputation of your organization. Sarah, let's flip to the next slide. So the second key thing is readmission risk reduction. So more and more, once a patient has been discharged from an inpatient visit, but also an ED visit, or even an urgent care visit, there's increasing responsibility on behalf of the provider to check in, make sure that the patient is doing what they need to be doing, to make sure that they have taken appropriate next steps, and also to make sure that particular conditions, especially urgent care conditions like UTIs, are not getting worse. So what you see on the left here is basically a sequence of discharge diagnostic questions that are designed to ask some basic questions around scheduled PCP visits, starting to take required medications, whether a patient is simply feeling better, the same, or worse, and some other basic factors designed to completely canvass a discharge population and bring back issues for staff to follow up. It's the ability to increase the coverage of those discharges and concentrate nurse time on patients that really do need help versus just making phone calls. In some customers where we have deployed this capability, we've seen a 32% reduction in 30-day readmission rate, as well as a 22% reduction in nurse workload. Again, it's a basic way to conduct this interaction, but as you can see, it's yielding powerful results. Sarah, let's flip to the next page. Back to patient-centered medical home and ACO initiatives, more and more organizations want to reach out to panels of patients, whether they're hypertensive, diabetics, COPD patients, and ask them for their health status between visits, and also potentially provide them with education on how to manage their conditions. This is an example here of a basic assessment that reaches out to patients between visits, asks them about their general wellness, asks them to provide their blood sugar readings, and that combined with a light amount of nurse case management in some of our customers has generated almost a 1 full point reduction in A1C. It's a basic interaction that has 5 times higher engagement than other channels. And uniquely, the response rate for this interaction that you see here, which literally takes a patient less than a minute to complete, oftentimes once a week, the response rate is typically around 70%. So the opportunity here is more leverage for scarce resources, which are your nurses and your staff, in order to deliver on results for your patients. Sarah, let's flip the slide here. We talked about some buzzwords on the prior slide. One of them was social determinants of health. A related matter is whole patient insight. And again, this is a fascinating and powerful aspect of PerfectServe's patient and family communication suite. With regard to everything I just described before, what you see here is the ability to bring social determinants of health or whole patient insight into this world of communication. And what this can be used is to take stress elements like, what's the financial stress of a patient? Can he or she actually pay for their medications? What's their transportation stress? If we ask them to come in for a couple of checkups, are they going to actually be able to do that? Food access stress. If we're instructing a diabetic to eat better, are they indeed going to be able to do that based upon the food that they have access to? And then general, housing and community stress. All of these telltales are not only important to look at face value, but they're also important in terms of helping a clinician to decide what type of diagnostics to go deeper with. How to ask more detailed questions about the ability to pay for medicine or eating right. So these indicators here are integrated into the solution that we've been talking about, and they're used in 2 ways. One is to simply show nurse case managers and clinicians these indicators on a per patient basis so that they can decide how to engage, but they're also used to flex the messaging. So where a particular emphasis needs to be provided to patients, these indicators can provide that emphasis. Where particular offers, you can think about things like a Lyft code to have a free ride to a visit, or a fruit and veggie coupon to go and spend $10 at a store on fresh food. Those can be delivered automatically to the appropriate audiences, either on a standalone basis or in support of a discharge or an upcoming encounter. Sarah, I think we've got one more slide. Let's flip to that. Now, I spoke before about the importance of making sure that all of this makes sense within the workflow of your organization. So what we see here is what we call the mobile communication manager. And this is a web portal which allows patient interactions to be viewed in real time. It has a suite of business rule-driven notifications, which will provide alerts to staff. And it also supports the real-time secure chat that I had mentioned before. Many of our customers start with this solution and use it to, as PFC is deployed into their departments or smaller work groups. But also other of our customers will start with the solution as a bit of an entry point, and then prepare a more comprehensive integration back into their EMR and scheduling system. But I wanted to bring this up because the emphasis in the last couple of slides was on the patient experience, which is powerful and delivers results. But that is really only half the solution. The other half of the solution is how this is presented to staff and how they build this into their workflow. So, with that, I'll thank you for listening about patient and family communication, and I'll hand it back to you, Jeff.
Great, thanks, David. Let's see, questions. Question here about just general setup. How is what does it take to set up these capabilities?
The integration process is designed to be as lightweight or as comprehensive as is needed. Many of our customers will actually start with flat file integration, where, for example, an extract from the schedule comes over to PerfectServe on a daily basis or several times a day. That's probably the most basic way to start, and it's quite effective. And typically it takes just a matter of weeks with the customer's IT organization to set that up. And then there are some more advanced methods of integration around HL7 and feeding data back into the source systems that can be built on top of that.
Great, thanks, Dave. Another somewhat related question: how do the actual patients get enrolled in this program? Not sure how many mobile numbers we have on file.
Yeah, that's a good question. So this PFC solution is HIPAA compliant, but it's also TCPA, Telephone Consumer Protection Act compliant. And part of the aspects of being compliant that way is the use of opt-out programs and what's called express consent. And so the TCPA has indicated that providing your mobile number to your provider allows your provider to use that mobile number in the service of caring for you. And as part of that, our system will typically receive multiple phone numbers for each individual patient. You can think about a home number and a mobile number and perhaps even a work number that would be in the record. We'll automatically go through those numbers and identify which ones of those are SMS compatible, and then automatically enroll those numbers, send the patient a message giving them instructions about what's next and how to opt out if desired, and then begin interacting with them. We found that in general, our customers can expect to be able to message with their patients immediately. Our customers can expect to immediately message with about 85% of their patient population, just based on the percent of patients who typically provide their mobile number as their number, in the healthcare system. So we can enroll 85% right off the bat. And the percent of patients that opt out, that say this is not for me, is typically less than 6%.
Great. Another question here regarding patients. What languages does this capability, or can this capability support?
That's a very important question. So currently, this capability can support generally any type of alphanumeric language or alpha language, with Latin characters as opposed to Asian characters, and the system uses the language flag that's in the record and then sends the message in the appropriate language based on that preference. So most of our customers will choose English with a Spanish alternate, but we have customers that select Polish, Hmong, Somali, and other languages.
Okay, great. One more question here. You brought up record here. Can a record of this messaging activity go back into the EMR?
Yes. So that's back to the ability to get started very quickly using a basic flat file integration, but then add on to that based upon what the business use case is. So all of this activity, ranging from the messages themselves to responses to alerts to even whether numbers are verified or not, can easily be made available for placement back into the EMR, and it could be put there simply for record keeping purposes, or it could be used to drive transactions.
Great, thanks, David. Well, it's about quarter to the hour, and I know we wanted to try to keep this to 45 minutes. Before I turn things over to Carlene, I'll just say, well, one, thanks again, and David, and if there's interest in learning more about these capabilities that David just spoke of, or anything you learned today, from Terry's presentation to Mary's update on product, get with your account manager, and we'd be happy to have some follow-up calls or meetings with you. So with that, thanks everyone, and I'll turn things over to Carlene to wrap up our time.
Thank you, Jeff, and thanks to all the participants for your valuable time today. We're excited to share this great news with you and look forward to doing more in the future. Just as a reminder, you can access today's slides using the handout dropdown in the GoToWebinar window. If you have trouble downloading those documents, we will include those in a follow-up email, as well as a link to the recording of this webinar so that you can share that with your colleagues. And I think we'll close the webinar now. You should see a short survey display once we close the meeting. We'd love to hear your feedback on today's experience. Thank you so much, and we'll be in touch. Hopefully we'll see you on the April webinar.